So what causes middle ear fluid, guys? Very common occurrence in the winter. Lots of patients coming in with bunged up ears. So this is a perfect example, and these are certain examples of what eardrums with middle ear fluid look like. You see a big retraction, almost as if that eardrum is being pulled back there over the handle of the malleus. And there's a lot of congestion, a lot of sinus-related issues causing this type of oral fullness. And you can see the inflammation inside this ear canal. That eardrum is full of fluid. To diagnose it, what we normally do is we complete a hearing test, and we also do a TIMP, which actually checks the compliance of the movement of the eardrum. So once we completed the test, it was fairly evident in all three of these cases that the patients came in with occlusion or blockages associated with middle ear fluid inside their ears. Usually the advice is to let it pass. It normally does within 3 to 4 weeks, but obviously if it's persistent and if it does turn into what we call an otitis media infection of the ear, then maybe a course of antibiotics might be the way to go. But we normally refer straight back to the GP for pathologies like this. But this is a very common pathology that we see, especially in the winter months, due to a lot of patients coming with colds, coughs, flus and congestion. And like I said, that's how we diagnose, and that's how we deal with fluid in the middle ear. So usually these kind of build-ups happen because there's a tube which runs from the back of your throat to the middle ear, which helps to ventilate the middle ear and helps with gaseous exchange on both sides of the eardrum. The eardrum sits perfectly inside the ear, and the pressure in the middle ear is the same as the pressure in the atmosphere. And two, it does help drain away fluid down the mucous membranes and down the back of the throat. However, when it does get inflamed or it does get blocked with heavy congestions or colds or sinusitis or respiratory infections, that's when you start to find that fluid gets drawn up into that middle ear, and sometimes it just sort of sits there in that pocket, which is otherwise a vacuum, and it prevents the transmission of sound effectively through the ear cavity, which then obviously leads to this sensation of oral fullness. Sometimes patients are coming in with a little bit of vertigo, a little bit of dizziness, tinnitus. So all of these symptoms can occur as a consequence of middle ear fluid. And as advised, like I said, it normally passes within 1 or 2 weeks. Sometimes it takes a little bit longer.